Non-selective beta-agonists are sympathomimetics, meaning they stimulate a sympathetic nervous system or fight-or-flight response. They do this by binding non-selectively to both beta-1 and beta-2 receptors. Beta-1 receptors are primarily found in the heart, whereas beta-2 receptors are primarily found in the lungs and blood vessels. Binding to beta-1 receptors causes a positive chronotropic and inotropic effect, meaning the heart rate and force of contractility increases, causing an increase in cardiac output or the amount of blood the heart pumps in 1 minute. Whereas binding to beta-2 receptors causes bronchodilation and vasodilation. The most common non-selective beta-agonist is isoproterenol. Non-selective beta-agonist use is limited due to their lack of beta receptor selectivity. Their vasodilatory properties decrease systemic vascular resistance, leading to a limited increase in systolic blood pressure from increased cardiac output, and a decrease in mean arterial and diastolic blood pressure. Therefore, non-selective beta-agonists are generally not recommended in hypotensive states, such as acute heart failure or cardiogenic shock. However, their positive chronotropic effects are used to treat bradycardia, and their bronchodilatory effects are used to treat asthma and chronic obstructive pulmonary disease, or COPD. The most common adverse effects of non-selective beta-agonists are tachydysrhythmias, nervousness, restlessness, tremors, flushing, diaphoresis or excessive sweating, hypertension or hypotension under different circumstances, and chest pain or discomfort. Non-selective beta-agonists should be avoided with tachydysrhythmias and hypotension. When treating bradycardia with non-selective beta-agonists, they are administered as a continuous intravenous infusion in an intensive care setting. The infusion is titrated to achieve a desired response, usually a target heart rate, indicated by the MRP. It is important to monitor the patient's hemodynamic status closely during this therapy. This includes heart rate and rhythm, continuous bedside telemetry, routine ECGs, and blood pressure monitoring. Blood work such as an electrolyte panel should also be completed routinely. However, if non-selective beta-agonists are administered for asthma or chronic obstructive pulmonary disease, a respiratory assessment including pulmonary function tests in some cases should be completed before, during, and after therapy. And finally, monitor blood sugars closely in individuals with diabetes, as they can cause an increase. I hope you found this video useful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!